Doctors of Reddit, what happened when you diagnosed a COVID-19 denier with COVID-19?
As an anesthesiologist, by the time someone's calling for us it's for intubation and the patient is in no condition to deny anything. Honestly, it's usually the family that's the issue and that needs to be escorted from the room. Infectious disease doctor here. Seen about 450 to 500 COVID patients in the hospital since it all started. Only one patient ever accused me of using the nasal swab to give him COVID, along with a microchip. A handful have, EDIT, ranted non-stop about China. Everyone else has been sick enough to accept it, but lots still refuse the idea of vaccination even after being in the ICU. Edit. Lots of questions about vaccination after having the infection. Immunity after infection can last as little as 3 months. Immunity from vaccination lasts much longer and has the benefit of not putting you and those around you at risk. You can get the shot as soon as you recover and come out of isolation, no need to wait for 3 months. https://www.cdc.gov/coronavirus/2019conf/fact.html #:text the %20 criteria %20 before %20 getting %20 vaccinated. Edit. Changed to immunity can last as little as 3 months. It can be longer depending on the person, but you can't predict ahead of time. I've got a patient in the hospital right now reinfected at the 4-month mark.
I work on a COVID unit and I ran into a patient like this. They'd tell me over and over again about how they weren't really sick and about how I didn't need to be gowned up in PPE. They even tried to take my face shield off. If you test positive for COVID 2 times then you have COVID. People are crazy. I'm an anesthesiologist, and in our institution, we're the ones tasked with intubating COVID suspects, positive patients who would otherwise die without ventilatory support. And holy beep, there are a lot of patients who don't believe COVID is real. Most of them believe that it's just an elaborate lie that doctors use to label random patients to mooch money off them. Some of them scream at us, in whatever capacity their diseased lungs can allow them to. Some outright refuse intubation, in which case they die several hours later from respiratory failure. It's emotionally taxing having to face that every shift.
Didn't diagnose, but I'm sure you'll appreciate the mental gymnastics. I worked obs and gyno a few months back. For obstetrics we had an amber ward, confirmed non-COVID ward, and a red ward, confirmed COVID/no test done. We'd require mum and partner to both get COVID tests done in our clinic the day before the planned admission so we knew which ward to place them in. One patient refused to have the swab taken because she thought COVID was a hoax. So we were told her she'd have to stay in the red ward during her admission as we couldn't confirm she didn't have COVID if she didn't have a test. She went absolutely mental saying, "You can't do that. What if I get COVID?"
Still had to treat her despite her accusing me of hiding the real diagnosis from her and doing something to make her sicker. Love my job.
I am here with most of 2020 spent in COVID land. I never had anyone refuse treatment when things got serious. I know some of the MDs I worked with got yelled at, like the rest of us, but honestly that happens frequently anyway. Some denier patients lived, many of which had accepted reality by the end of their stay after seeing what we all were going through to treat them. Some died telling me I was a sheep or an idiot or a liar between gasps of air. COVID didn't care.
I'm a student funeral director and I see families go to the funeral of someone who died of COVID-19 and still deny it. They started out shrieking at the doctors to change the cause of death on the death certificate. Now FEMA is helping with funeral expenses for COVID deaths. Suddenly there's changes of heart. I had a lady who was maxed out on high flow, next step is breathing tube, who still refused she had COVID and was holding a negative test in her hand that she had taken a week prior.
I'm an attending physician at our triage unit. On a Friday, an older gentleman, 60-plus years, came in with his entire family, wife, sister, Bill, 2 newfies and 3 children, none of them with a fast mask. All had mild COVID symptoms except him. He was saturating 80% with evident shortness of breath. We insisted in doing PCR and a chest CAT scan looking for COVID, but he and his wife refused, saying that COVID wasn't real and it was just a bacterial infection. The more we talked with him, the more agitated he got, to the point that his face was red. We suggested hospitalizing him to stabilize him and start treatment, but they accused us of exaggerating his symptoms and that we only wanted to hospitalize him so we could steal the liquid in his knees, a beep rumor that was going around when this whole thing started. They both cursed at us and said they were going to a better hospital to get antibiotics. Fast forward 24 hours later, on Saturday, we get a call from the hospital next county over telling us that they intubated one of our patients because he went into respiratory failure when he arrived, and they had to transfer him here because they don't have the appropriate equipment. We transfer the patient on Sunday only to find out on the CAT scan he had 90% of lung damage. He passed away on Monday morning. Just before the family took the body away, I gave the widow the death certificate that I filled out, and before walking away, she turns around and waves the certificate, yelling, "See? I told you it wasn't COVID. It says here, death due to pulmonary pneumonia due to SARS-CoV-2. I knew it was a bacteria. I told her, SARS-CoV-2 is COVID-19, ma'am. Edit, because everyone's asking what happened afterwards. Not much." She yelled, "No, it's SARS. It's a bacteria," and stormed off. It's actually one of the mildest encounters I've had with a grieving widow.
My mom works for an OB-GYN who specializes in high-risk pregnancies and births, and he was called into the hospital to check out a woman whose due date was about 2 weeks away and who was very sick. He confirmed she had COVID and admitted her to the hospital until she gave birth, but she insisted it was a hoax and ended up checking herself out AMA. But not before she spat in the face of the nurse, who coincidentally had just completed chemo. That was near the beginning of the pandemic, and I'm so curious what happened to that lady. The nurse is okay, thank goodness.
Doc chiming in, they told me I was wrong. Obviously, there's no way they had COVID despite coming into the ER for shortness of breath, cough, and fevers. When I mentioned that their wife, who was several rooms down, also had COVID, their response was, "Oh, that makes sense because she always gets sick." When I asked how it made sense that they wouldn't have COVID with the same symptoms, I was told that it was because they were overall healthy and only took their mask off to eat and drink in the casino upside down face.
My worst experience was when a 2-year-old kid got diagnosed with COVID. His mother had brought him with CO fever and diarrhea. The child was severely dehydrated, and so we had to do a mandatory swab test since we planned to admit him. It came positive and the mother refused to admit it. We were ready to perform a repeat test and we even advised for the parents to get tested. Her defense was the child never left the house. It's just I and the father who go to work daily. The grandmother babysits while we are away. How can he even get COVID without leaving the house? She had called her husband. He came with 10 to 15 relatives in a car. They broke a few chairs and then left with the baby. We just informed about the case to the COVID control center.
My wife's a nurse, just had to deal with a patient who refused to get tested prior to her surgery, so they had to treat her like a COVID patient and needed to charge her for all the added PPE like gowns, goggles, etc. The kicker is, recovery wouldn't take her for observation while she was woken up, so the anesthesiologist needed to stay and monitor her in the room for nearly 3 hours. They are billed at $400 per 15 minutes, and there is no way her insurance is going to cover the extra cost because she signed a document saying she denied a COVID test.
I'm a doctor working in acute internal medicine. I've seen lots of COVID over the last 12 months, probably 300 plus cases. The one that sticks out in my mind the most was a 70-year-old lady with COPD. She refused to have a vaccine because she didn't trust it despite the fact she was eligible for one for weeks beforehand, in the UK. Subsequently caught COVID and was admitted to hospital. She repeatedly doubted this was the diagnosis. She refused to go to our COVID high dependency unit despite quite significant respiratory failure. Of course she deteriorated over a number of days to the point where she was on maximal oxygen on the ward and at that point finally accepted treatment in HDU with high-flow oxygen, although continued to doubt she had COVID. Died within 24 hours of her HDU admission, having refused to go to ICU. And of course, what did her family say? They were convinced she never had COVID and even went as far as accusing us of withholding life-saving treatment from her. Unfortunately, there's no treatment for stupidity. Edit, spelling.